Hello, we are students from Hardin-Simmons Physical Therapy Program in Abilene, Texas. My name is Tori.
And I'm Emily, and today during this short video we will be discussing the opioid epidemic and our role as physical therapists in this crisis. This issue is really important to us as future professionals because we want to provide our patients with the best quality care in the future.
In this video, we will be interviewing two patients with the same condition, one who received opioid-centered treatment and the other one who received physical therapy. Come on!
So tell me about your problem.
Well, 7 years ago, I was setting up my Christmas lights because my husband was gone, and I fell off the ladder. I had sharp back pain for 2 weeks, so I went to my physician, and he prescribed me opioids.
Okay, so have the opioid pain medicine, has that helped or hurt? What's going on?
Yeah, well, at first it was working great when I had an onset of pain. Then eventually they weren't strong enough for my pain, so I went back to my physician, and he gave me a stronger prescription. Now I'm 7 years into taking them, and I have to go get a stronger prescription every 6 months to help dull my pain that has yet to cease.
Okay, so, but besides having to get a stronger prescription, are there any other issues going along with that, or do you just need more medicine?
Yeah, not a lot going on. They help manage my pain for my back, but there's been a lot of other things come up since. I wake up in the mornings nauseous. If I miss a day of not taking them, I get withdrawals and intolerable pain that makes it so I can't get out of bed. I'm pretty tired all the time, and I have started seeing a counselor for my depression. Sometimes the opioids don't keep me on the high that I need, and I've started trying heroin as an alternative.
Yeah.
Pretty intense, huh? Opioids are a powerful form of medication that produce a morphine-like effect and are used for pain management and anesthesia. These drugs have general side effects including itchiness, nausea, constipation, and euphoria. So when the use of opioids is discontinued, patients can even experience withdrawal symptoms. Escalating the use of these opioids can influence recreational use and potentially lead to addiction. According to the American Physical Therapy Association, the opioid epidemic is developed from physicians and pharmacists ordering for opioid-centric solutions to dealing with pain, leading to widespread addiction and misuse. This effort may have originally started out with pure intentions to help patients reduce their pain and reduce it fast, but researchers and advocates against the use of opioids argue that the source of the pain typically goes unidentified and therefore uncured. Now let's take a look at an interview observing how a patient found relief with physical therapy as her primary treatment plan.
So tell me, what are your problems?
Yeah, so 4 months ago, I was helping a physical therapist transfer a 300-pound patient, and I strained my back. I waited 2 weeks until going to my physician, and they gave me an option of working with a PT or getting prescribed opioids.
Okay.
I work with PTs, and I decided that was the more conservative intervention to go with.
Great, so has PT been helpful? How's your pain progressed over the past few months?
My back pain started feeling better after 2 months of physical therapy. I feel stronger, and my PT told me it would help prevent possible future problems when transferring patients. I actually have more energy. I've continued my exercises that were given to me 2 months ago to help prevent my pain from spiking again.
Wow. So, okay, now on the patient side, as a nurse working with patients who probably have back pain, what would you tell someone who's thinking about treating that with opioids?
Yeah, opioids don't help you recover that fast. They don't help you get your range of motion back. They don't help you make the progress that you need to make in order to get your strength back and return to your life.
Wow.
So I would suggest PT.
Okay, great.
Wow, isn't physical therapy great? As physical therapists, our approach to pain is to treat the underlying causes, not just mask the symptoms. Physical therapy empowers the patient to be more involved with their plan of care and their treatment and pain management. Using movement and exercise to treat pain not only directly addresses the patient's chief complaint, but also acts as a preventative intervention to many other health problems as well. These include a higher number of sick days, overweight and obesity, increased risk in cancer, and higher mortality rates. Physical therapists are trained in differential diagnosis and are skilled enough to determine when pain is being caused by something that is not musculoskeletal, neurological, or within our scope of care. Physical therapists are then able to properly refer a patient to another source of health care to receive treatment.
We're not trying to negate the importance of opioids in treating pain, but we do desire to challenge the current abuse of prescription painkillers in the United States as a result of them being used as primary intervention. National surveys have found that chronic pain affects approximately 100 million American adults, and that the economic cost is $600 billion annually. This is a huge financial risk to our country. So state and national legislation, we're looking at you to help with this crisis and pull your weight. APTA and TPTA are publicly and actively advocating for patients' best interest for non-invasive and non-pharmacological treatment options. The answer? Physical therapy. As the APTA would say, you have a choice. Choose more movement and better health. Choose physical therapy.